It's a medical malpractice case that could put New Mexico patients and Lubbock doctors at risk.
Our Claudia Tristan has the details on how this case threatens health care across state lines.
At least once a month, sometimes twice a month, with his doctors and my doctors. We usually got one of them about every month, so we keep the road hot.
For Clovis residents Linda and Jerry Hall, crossing the New Mexico border into Texas is part of their routine to get the medical care they need.
Well, my husband would have died because if he wasn't able to get a stent, he would have died.
A medical malpractice case before the New Mexico Supreme Court is threatening access to care for New Mexico residents who get specialty medical treatment in Texas.
We are facing this situation where a patient submitted a suit against one of our physicians at Texas Tech with an event that happened 7 years before.
The plaintiff wants New Mexico law to decide the case, even though the procedure was performed in Texas.
The difference between what Texas says and what New Mexico says isn't just a little bit of a difference, but it's a huge difference. So doctors are going to be forced to have to make decisions about the kind of risk that it puts them in if they treat patients from New Mexico in Texas,
leaving Texas doctors to reconsider their liability plans.
They're already spending a significant amount of the resources with the overhead and the liability coverage. If this goes into effect, which means that they'll have to buy even more to have more coverage, which means that then their overhead will be even higher than what it is right now. So everybody's in a little bit of a panic.
Should the case proceed, Texas doctors may have to turn away out-of-state patients.
Doctors are going to have to make some decisions about whether or not they want to continue treating New Mexico patients here and be subjecting themselves to potential liability that I don't think any of them could have foreseen prior to this case.
For the Halls, this would mean having to get specialty care in Albuquerque.
It would take twice as long. And then we're able to get back home in the same day. Where if we went to Albuquerque and saw hardly any doctors at all, we wouldn't be able to get there, get treated, and get home in the same day. So we would have to be out of a motel room, and it's a lot more money for gasoline. And then it's a bigger town, and it just would take us longer to get around. And so we're just thankful that so far we have been able to come over here.
Cordero says until a decision is made in the New Mexico courts, his staff will continue to care for all patients.
We're providing the care just like we do anytime until there's a resolution of this. We don't want to be guarded. We want to provide that care. That's what we're here for.
With photojournalist Andrew Wood, I'm Claudia Tristan, Fox 34, News at 9.